I'm often asked by my patients with lupus, can I go out in the sun? Well, about 6 out of 10 people who have lupus are sun sensitive. If they go out in the sun, they develop rashes, their arthritis can flare, and they can have flares of other organ systems in their body. So if you have lupus and you're sun sensitive, we advise that you try to avoid peak hours in the sun. That is between 10 a.m. and 4 p.m. So I highly advise patients who have lupus to avoid the sun. That means wearing wide-brimmed hats, staying out of the sun, and staying away from reflected sunlight. Reflected sunlight is, of course, seen at the beach, off the water and the sand, but if you go on a winter vacation and you go skiing, there's a lot of sunlight that's reflected off the snow. So avoiding the sun is important for lupus patients. You also have to be careful because sometimes the types of radiation that is set off by the sun can go through glass. And some people who have lupus develop rashes and fatigue and arthritis by being exposed to sun just from sitting in their car and the light going through the windshield. The other thing is wearing sunscreens is extremely important for most of my patients with lupus. And then there are medications that can be taken. So it's important to talk to your physicians about measures you can take to avoid sun exposure and avoid your risk of having your lupus flare.